let's go back to our conversation. And Val Halamandaris is the president of the National Association for Home Health Care and Hospice. And I'm going to go around the room if you have questions, and then you'll be able to ask directly the panel. So if you have questions, please just raise your hand, and then we'll get into the program. But Mr. Halamandaris, recently I went through the experience of seeing somebody very close to a friend of mine dying at home. And this person had immigrated to the United States when he was 12. He was dying and he was 92. So he deserved everything that he had worked for. And one of those things was Medicare. He moved into his house because he asked to die at his home. And he wanted to be there. He had this horrible stroke, and he was half paralyzed. He couldn't speak. He couldn't swallow. It was horrible. And this was in California. And the service that he received was very good. It was incredible. 24 hours with constant care and everything. I was told that that is not a typical case. But he was able to do that and to get it. How difficult is it to get those kinds of services?
Well, the word hospice means care for individuals who are in the last 6 months of their lives. That's part of the Medicare program. 49 states also have that as part of Medicaid. It is a very essential service. I believe that we are here together, as I said a while ago, because we're fighting the last great civil rights battle. Not that we've won the others. We haven't won the battle for freedom of African Americans or women's rights or to make sure that Hispanics are treated equally. But the last great civil rights battle is, why is it that when you become old and ill, all the freedoms that you enjoy get taken away from you? Why is it that you are put into an institution, in many cases against your will, when you can have the experience like your friend had? Yeah. The only question that I have about hospice is, why do we wait till they're dying? Why can't we come in when people need the help to remain independent in their own homes? The Supreme Court said it's a constitutional right to be cared for in our own homes instead of being placed in an institution. It's our tradition. In our tradition, we take care of our own. You don't see many people in the Hispanic community that neglect the care of their parents. In fact, the family is the bedrock of society, and one of the great gifts is that the extended family still exists, thank God, in the Hispanic community. And it's one of the things that we bring to this nation that makes it richer. But we're going to decide as a nation what our program is going to be relative to individuals that are old and ill. And if you'll forgive me one more sentence, which Please is, do. In every society, there were only 3 systems that worked. Among the ancient Greeks and the Chinese, they venerated the elderly to the end of their days. And the second policy was a sort of benign neglect, or Armando, as you know, when you became a burden on society, they left you behind, or it was your responsibility to leave society. Or the third policy was you were killed. That's sad, but that's the way it was, A, B, and C. And I heard President Kennedy say when we were arguing for Medicare, that what we needed to do is take care of people to the end of their days. We have the money, we have the resources to do that, and what is at stake is the very future of American democracy and how we're going to be viewed through the prism of history. Because all great civilizations, he said, could be measured by a common yardstick. How do they take care of our vulnerable populations? So we are going to determine now, in this debate that's going on in Congress, what our policy is going to be toward individuals, the future generations, 78 million baby boomers. What did you say? 10,000 a day for 20 years?
Yes.
Are going to be elderly. And then we have, 41 million seniors now and 12 million disabled. It doesn't take a rocket scientist to know that this is going to hit us like a tsunami. And we have to be prepared. And long-term care and programs in the home that help people stay there independently so they don't weaken and get disabled and then wind up in an institutional setting. To allow that to happen is morally bankrupt. It's wrong, it's not America, and it's certainly not in the Hispanic tradition.
Please, Ms. James. Yes.
I just wanted to add to that, because this is one of the things that the Affordable Care Act is attempting to help do. And one of the challenges for so many people is a lot of people do caregiving, but knowing, first of all, that there are those resources available to help make the caregiving easier, both for the individual to remain in their home and for the family members who are caring for them. And oftentimes our communities aren't aware that those resources exist. So there's an effort that needs to be made to do better outreach to those populations to make them aware that those resources are available. And in the Affordable Care Act, the CLASS Act, which, you know, in our world we tend to think of the culturally, linguistically appropriate services, but as the community living assistance subsidies, services subsidies. That is an effort to allow people to invest into an insurance program that would allow them to get money to help make sure that they can stay in their homes to do those things that are not medically covered under insurance via Medicaid or Medicare. And that's another program that was part of the Affordable Care Act that has started, that people are now allowed to pay into, but we need to make that aware to our communities that they're aware of that option.
Thank you, Dr. James. Ms. Niño,
Yes,
please.
and I wanted to add just 2 quick points to that. One is, as my colleague said, Martin Luther King Jr., Dr. Martin Luther King Jr., who fought for civil rights, fought for fair housing, fought for labor rights, fought shoulder to shoulder with the farm workers. Out of all those battles, he said that the biggest injustice there is in society is our healthcare system. And that is evident, and that's what the congressman alluded to when he talked about how people were bankrupt before. Because before Medicare, before Medicaid, the poor and the elderly were completely neglected. So again, just to reinforce that this is a civil rights issue in a way. The other part I wanted to mention in regards to outreach, this may seem like a very minor step, but I think our community could really appreciate this. Under this administration in the Department of Health and Human Services, we've started a promotora initiative. We all know about promotoras. You know, they're our neighbors, our comadres, the woman that we see at the bus stop, at the beauty salon, or the gentleman that we meet who always has that bit of information that knows about, no, this is who you have to see, or really, well, you should take this, or you should talk to so-and-so, and they always are the ones to give you advice. Well, we're starting this initiative that offers free training via webinars, via any vehicle of communication that we have, but we're developing a network identifying all the different promotoras throughout the country, because there is no one group of promotoras like an association. So we're identifying all the different promotora organizations throughout the country and offering them these opportunities, bringing them together so that they can, among themselves, network, learn best practices from one another, and help our community in our language, in our culture, and in the way that we like to receive information.